Now, the mankind always has been in sports, and from centuries, the man has been playing sports, getting injured, coming back again. And these injuries, coming back from these injuries is one of the most toughest thing. And so many factors are involved. The way you manage them at the site, immediately after, later on. And apart from physical injuries, the psychological injuries, the psychological blocks, that's the one are more difficult to tackle. But we have other faculty to deal with that, but let me stick to the physical part of it, being an orthopedic surgeon. Now, sports are integral part, and this was a theme of WHO somewhere in 2001, where they said sports and activity are for the health of everybody. And in all sports, you acquire highly skilled activities which look potentially dangerous, but with practice, coordination, and acquired skill, you make them easy. And these are the things which always look to be prone for injuries. Now we have seen contact sports like football or hockey or American football, rugby. They are the ones where we find more injuries than single sports like swimming or athletics or something. So coming to the people at risk for injuries. Now who are the sports person who are at risk? All sports person need not be at risk for injuries. Now these are another sports, again not too many injuries, but the people who are at risk are people like us who are all the time doing something else, and we are so-called weekend warriors. We like to spend our Saturdays, Sundays coming back to sports, doing few things, and we are the people who are more prone for injuries. People who are just injured and are coming back to activity, they are other people. And again, people like me, just 60 plus, and I have tried to do things which I was doing at 20s and 30s athletics. I am a guy, people like me who are prone for injuries, when the body doesn't respond to your. Secondly, people with inherent physical defects. Now we have a lot of people who have some physical deformities, unequal leg lengths, very minute, not much, half an inch, 1 inch, but it does make a difference when you are in competitive sports. Flat-footed, pronated feet, deformities of the knee, quite common. Bow legs and all, it's quite common, especially we see in a lot of footballers. I don't know what is the correlation, but a lot of footballers come to us with bowing legs. Improper training, inadequate training. Most important is inadequate warm-up. Now this is one of the chief cause of injuries that we see. And mostly seen when one doesn't do or one doesn't come for training in time. We see people coming late, and then instead of doing a proper warming up, they straight away join to the sports activity. This is very commonly seen when we see these patients with muscle pulls and tears. Same way, it has been very well proved that people who are very much flexible, they get less injuries than the guys with less flexibility. Environment, we talked about environment in the morning, but again I would say check the weather where we are practicing. In Goa, we have a lot of injuries during rainy season when football grounds are slippery. And the ground condition. Now we used to have a lot of players injured in playing in paddy fields. The paddy field season is over, the fields are right, and we have a lot of our footballers playing there. Actually, we have played so many times when there are alternative grounds in Goa. And one of the things, I think the professional players have been warned not to play in those village tournaments and where they have many injuries. Faulty equipments, another common cause of injuries. When the equipments are not up to the mark, when you are wearing running shoes for football or you are wearing football shoes for athletics, you are bound to get some injuries. So these are the risk factors all of us must consider to prevent the injuries. So basically risk factor we can divide into intrinsic and extrinsic. Intrinsics are the ones which are inherent to the sports person, could be modified. Biomechanics, muscle strength, flexibility are the ones which we can improve ourselves. While age, gender, ethnicity are something which we have and we cannot change that. Extrinsic causes, They are not inherent sports person. They relate to training, nutrition, environment, ground condition, equipment. So these are the risk factors which are not directly inherent to the sports person. The injuries can be divided into acute injuries which are traumatic, sustained on field, during competition, during training, and the other and most difficult to treat, are the overuse injuries. These are a thing by itself. Acute injuries are straightforward. You sustain an injury, you know the treatment, you treat them, you come out of it. Now these are the injuries which are difficult to treat. I'll come to that in a minute. So in competitive sports, when the athletes have reached certain amount of proficiency, certain amount of skill, we find more of this overuse injuries when they want to compete more. The motto of Olympics, higher, faster, stronger, you try to achieve more and more. You try to better yourself, looking at somebody else. And ultimately, many times you land up with this overuse injuries. And recreational sports, we see more acute injuries when they play under bad conditions, when they are not adequately trained. And let me classify the sports injury further. The different types: fractures, dislocations, muscle injuries, ligament injuries. We'll take them one by one. The fractures is an acutely traumatic injury. It's one of the severe injuries, one of the severe sports injury that we see many times. And the fracture is called a closed fracture when the skin is intact and the bone is not sticking out. And it's called a compound fracture when the bone is exposed or there is a wound which is complicating with the bone. Now, these are very severe injuries with a lot of complications. I'll come to that. And we have what is called a stress fracture, which is mainly an overuse injury. Again, I'll come to that in a moment. So the fractures is what I have depicted here. They are classified according to the type of fracture. That's a transverse, oblique, and each one is caused by a different type of trauma. Some of them are related to particular sports. So these are multiple fractures. And here, where the blood is covered, skin is broken, bone is complicating outside, is called a compound fractures. Now these are potentially dangerous factors because the external environment, the ground, the field, the ground condition, or your clothing, everything has contaminated the fracture. These are chief cause of a very high chance of sepsis in these compound fractures, the infections, and more complications of fractures. So the management of this fracture is complex, and you can see a photograph of where the bone is sticking out. Another one here, similar thing. So these are very complex and severe injuries which need to be adequately treated. Now skiing is a sport, not here too much, but very commonly we have this sort of fracture, the spiral fractures, because there is rotational element in skiing. And this particularly and classically causes this sort of fracture. Another common complication of fractures which we have to dread is damage to the nerve or blood vessel around the fracture. It's very common around the elbow fractures. You can see the bone is fractured and this is the blood vessel and the nerve which goes in front, but these are damaged. It can mean losing a limb to an athlete or to a sports person if the injury is severe or not adequately managed. So these are very drastic complications of fractures which sometimes we happen to see. Another thing about fracture management is what we call a fracture disease. Now, because of a fracture and a long period of immobilization, a long period of severe injury to the tissues, we'll end up with fracture disease. That is, there is a wasting of the muscle, the muscles become weak, the muscles become, they decrease in size, the joints become stiff, function is decreased, motion is decreased, and a very long comeback time from injury, because you have to overcome all this and come back to the sports level. So in this, most of the footballers or athletes, we would rather have the fractures treated by internal fixation, that is with plates or screws. which give you a rigid fixation. We can mobilize the patients faster, avoid all the things that you have with fracture disease, and make a faster comeback to sports. So most of the injuries or most of the fractures, we would rather prefer to treat them surgically than by closed method to avoid these complications of fractures. These are very well known to all of you who have suffered injuries. Secondly, dislocations. Now these are also very traumatic injuries we see on the field. Actually, the pain in a dislocation is much more than pain in a fracture. That's because whenever there is a dislocation, there is disruption of all the joint tissues, of all the ligaments, of all the muscles of the capsule which hold the joints together. So this injury is pretty severe. Pain is quite a lot. And we have the acute traumatic dislocation, and we have what is called as a complication of this is a recurrent dislocation. Now recurrent dislocations are the ones which you get with a minor injury or a minor a particular movement, very common in shoulder. You just throw a stone or something and you dislocate, the shoulder gets dislocated. Or you throw a ball, cricket ball or a badminton racket and the shoulder comes out. The cause of a recurrent dislocation could be a very severe injury to start with, B, improper or inadequate treatment. Because many times what happens is as soon as dislocation is set back, the pain decreases and the athletes don't like to hold on immobilized for a long time. So they go back to sports immediately. That causes this recurrent dislocation. So you have to be very careful when you have a dislocation. See that you take adequate treatment and then go back to sports with proper doctor's orders. Now this is an example of a shoulder dislocation. Say this shoulder is out, this is the X-ray, this bone is supposed to be here. Another common dislocation is the elbow. You can see this X-ray of, you can see the X-ray of a dislocated elbow. This should be the normal. This is another common injury, a quite severe injury. This was a photograph from Beijing. One of the weightlifters dislocated his elbow. So the dislocation elbow is also not uncommon. Coming to the ligament injuries. Now friends, you know the ligaments are the ones which hold the bones together. They are the ones which strengthen your joint. They prevent abnormal movement of a joints. So they are very important for us, for the athletes and for the sportsmen. Now you can see this is a diagrammatic representation of ligament, one bone down this. Now it can be ruptured totally, it can be ruptured partially. Now this is less severe injury compared to the total rupture. And it has two ends, so it can be ruptured here, or it can take a flake of bone and get ruptured here. Now these injuries are very common around the knee and the ankle, more than anywhere else. So what we call a local ankle sprain is a ligament injury of the ankle. Now let me put a word of caution. Now if you see the ankle ligament, there are three components: the anterior, middle and the posterior, or the tibiofibular, tibiocalcaneal and tibiofibular. In a common strain, only one ligament gets ruptured and it just comes as a swelling around the ankle with a sprained ankle. Better to treat, easier to recover with the proper thing. But when all three ligaments get torn, ankle is basically unstable. The ankle loses the stability and you can really difficult to differentiate between a partial and a total tear. So here, a proper physical examination, a stress examination or a stress X-ray, and nowadays with MRI, you are able to understand how many ligaments are torn.